Attention pregnant women. Pregnancy does not need to be full of pain and suffering. Let's explore how. Are you silently suffering with thyroid, high blood sugars, low hemoglobin, or constant fatigue? Do you feel helpless even after taking pills, worried about their side effects on your baby? If you are confused, scared, or lonely and searching for authentic guidance, this orientation is for you. Whether you are a working woman, a homemaker, or a second time mother, My Wonderful Pregnancy understands your journey. This program is designed to meet you where you are with care that adapts to your unique situation. Do you end up sometimes overthinking, sinking in fear and negativity with such kind of thoughts? Now, here's my promise to you. By the end of this orientation, you will see how My Wonderful Pregnancy can help you enjoy a healthy pregnancy, promote lasting well-being, and nurture your baby with confidence. All this with our four-dimensional approach. And if it doesn't feel right, you may leave within the first 2 weeks of joining and will receive a full refund. You will learn how to overcome common pregnancy problems in just a few weeks and how to avoid health risks for both you and your baby without unnecessary medications, unsafe treatments, or tough lifestyle changes. Now, this video is for you if you have ever thought, I want the best 9 months but don't know how. I worry my baby may face growth problems, stress is hurting my relationship, or we are unsure but really want to give our baby the very best as a couple. Now, my request to you and your spouse is simple. Shut down distractions, stay focused, and listen closely. This video is about to provide tremendous value, especially for your baby. Now, before I reveal the secrets, let me first share who I am. I am Dr. Manisha Joshi, an obstetrician and gynecologist practicing in Pune for more than 25 years now. I am also a mother of 2 boys, and together with my husband, Dr. Abhijit Joshi, an anesthesiologist, we co-founded My Wonderful Pregnancy. Our mission is very clear, making pregnancy joyful. We empower and educate couples to enjoy a healthy pregnancy, welcome a smart baby, and embrace natural delivery. Now, this journey began in 2000 when I realized that instead of enjoying this phase, many modern women were stressed, burdened, and overwhelmed by responsibilities and constant worries about their baby's safety. Now, too often, modern women are sedentary, eat unhealthy, suffer silently. Some even feel pregnancy is like a sickness, and many are forced to quit successful careers. Now, when I looked at these statistics, I was alarmed. Up to 70% of women experience backache in pregnancy. Thyroid imbalance affects up to 15%, and gestational diabetes impacts 10 to 12% in India, with rates as high as 70% in some regions abroad. Now, 3 to 6% of newborns face congenital anomalies from just 10% in the 1990s. Now, more than half of modern women undergo C-sections, with rates exceeding 90% in big private corporate hospitals, especially in metro cities and certain states. Now, factors include scheduled deliveries, maternal age, IVF pregnancies, financial incentives, and even cultural practices like Muhurat births. Now, these trends raise concerns about medical necessity and long-term impacts on mothers and children. Now, stress during pregnancy is also linked to rising behavioral problems in children. Now, that's when I decided to help pregnant women enjoy a healthy, stress-free pregnancy, no matter their history of miscarriage, C-section, age, twin pregnancy, or other challenges. I wanted every woman to truly enjoy the 9 months. And I took this up as my life purpose, and it gave birth to the mission, My Wonderful Pregnancy. Along with seeing patients in my clinic in Pune, I also provide online consultations and continue with deliveries and surgeries, all to support this vision. I think a natural approach contributes to long-term health of the baby and the mother too. This marked the beginning of our journey to build the team and support system for our vision. You have me as your gynecologist and my partner in life, Dr. Abhijit, as your second medical expert.
Namaste. In addition to practicing anesthesiology, I'll guide you and your spouse in My Wonderful Pregnancy. We ourselves applied the four-dimensional, holistic approach in both our pregnancies, enjoyed healthy, joyful 9 months, and had normal deliveries. My Wonderful Pregnancy combines modern allopathic knowledge, evidence-based methods of ancient science, and over 25 years of practical experience in supporting our patients. Along with Dr. Manisha and myself, our pregnant couples receive daily support from certified prenatal yoga trainers, accredited personal coaches, and a dedicated team. Let's meet our first MyWP pregnancy mom, ex-Major Mohini Kulkarni, a lawyer by profession and a former army official. She joined MyWP during her first pregnancy. Mohini embraced the four-dimensional approach. She enjoyed a healthy, joyful 9 months pregnancy without any hiccups and had a normal delivery in 2012. Today, she is a proud mother of 2 healthy teenage daughters. Just like Mohini, hundreds of women with different challenges, whether scared by stories, they were told pills were the only way, warned about age or complications, or pressured towards C-sections. Most avoided complications, and the majority achieved normal deliveries too. Let me now reveal the secrets that have already helped over 800 pregnant women, transforming them from silently suffering with physical and emotional problems to reversing those challenges naturally and achieving normal birth. In this video, we will cover 4 secrets. You don't have to be sedentary. You don't have to be stressed. Being 30 plus doesn't mean complications, and normal delivery is possible for each of you. Let's start with secret number 1. You don't have to be bedridden just because you are pregnant. Many women fear activity due to doctor's advice, family pressures, and their own worries. But here is what doctors don't always tell you. Actual medical research shows that lack of physical activity can lead to or worsen so many medical conditions often associated with pregnancy. The list, it is exhaustive. List from risks of inactivity: excessive weight gain, reduced stamina, low immunity, emotional distress, anxiety, postnatal depression, even reduced oxygen flow to the baby, affecting the baby's growth. And here is what you need to know. You do not have to be sedentary or on bed rest to achieve a safe, healthy pregnancy. I'd like Dr. Manisha to explain this from a medical perspective.
Yes, this is a medical fact. Healthy pregnant women, regardless of age or history, can and should stay active. The belief that activity causes miscarriage or preterm delivery is a myth. Let's understand this better. The uterus grows from less than 70 grams to over 1000 grams, from the size of a pear to a watermelon. In active women, this change happens smoothly, but prolonged inactivity fails to support this massive transformation. During pregnancy, your body undergoes massive changes: increased blood volume, loosened ligaments, and pelvic adjustments, and movement is the medicine that helps you cope. For decades, women were told to take it easy or even prescribed bed rest. But scientific studies show the opposite. Sedentary pregnancies carry higher risks compared to active ones. In 2025, a study found that women who exercised regularly had a 25% lower risk of C-section, 30% lower risk of gestational diabetes. The WHO recommends 150 minutes of moderate activity per week, yet fewer than half of pregnant women achieve this. Those with gestational diabetes who practiced walking or yoga had better glucose control and needed less insulin. Isn't that amazing? Studies prove that exercise results in shorter deliveries, reduced risk of high blood pressure, and postpartum depression. In most cases of low-lying placenta, it shifts to normal, making activity safe with guidance. For women over 30, IVF pregnancies, or prior C-sections, prenatal exercise strengthens the core and pelvic floor, reducing labor risks and aiding in a quicker recovery after delivery or a C-section. Women with thyroid imbalance on medication can improve thyroid function, lower TSH levels, and sometimes even stop pills, all through regular prenatal exercise. So, why the fear? Many women and even some gynecologists still believe movement might trigger miscarriage or preterm labor, but these fears are unfounded. ACOG clearly states that restricting routine activity is not recommended for most pregnancy complications. Even in ancient culture, pregnant women worked in fields, carried loads, sat on the floor, and walked. And no wonder there were fewer complications and more normal deliveries.
Yes, that summed up importance of exercise and an active lifestyle. Now, meet Amruta Kulkarni, a 32-year-old software engineer. At 12 weeks pregnant, she was on insulin and oral medications for gestational diabetes. She was struggling with bloating, constipation, excess weight, and fear of passing on diabetes to her baby. But when she embraced the four-dimensional approach, everything changed. Together, we helped her deliver a healthy baby at term, while her digestion, skin, and sleep improved. Her HbA1c normalized, her medications were stopped, and she fully healed her gestational diabetes. The obvious end result? She is a confident mom of a healthy baby girl today. Here is secret number 2. You do not have to be stressed in pregnancy. Many believe stress is natural and normal, but accepting it without working on it only makes things harder. Here is what you need to know. Pregnancy doesn't have to be a storm of stress. With the right support, it can be time of strength, clarity, and connection. Medical reports and scans show physical health, but true wellness requires a mental and emotional balance. Research and countless stories of stress-free, joyful pregnancies in our community prove this point. Dr. Manisha, can you please explain this a little bit further?
With over 25 years of experience as a gynecologist, I say this with conviction. You cannot be fully healthy or have a healthy, intelligent baby if you are living with chronic stress. I know many of you face waves of negative thoughts, worries about work affecting your baby, doubts about enjoying pregnancy while balancing professional life, unsettling what if that steal your sleep, even nightmares that leave you anxious throughout the day. People may tell you that these signs are normal and they ask you to ignore them. But let's unpack the truth. Why is the modern working woman stressed in pregnancy? Now, there is fear of miscarriage or complications with bleeding, low-lying placenta, twins, or gestational diabetes, and confusion from online searches, where Google often amplifies worst-case scenarios. Stress also comes from lack of clear, empathetic guidance from doctors, pressure to perform at work and home, and previous surgeries, or being over 30, often misinterpreted as high risk. Even some gynecologists, out of caution, may unintentionally instill fear by overemphasizing risk without reassurance. But here's the truth. Being calm, centered, and supported is not a luxury. It's a medical intervention. Here's another rarely spoken truth. As doctors, we are rigorously trained in medicines, procedures, and managing complications. But when it comes to prevention, natural practices, and holistic well-being, our formal education barely scratches the surface. No pill can dissolve emotional stress, but when you care for your lifestyle with simple, consistent practices, you build a healthy, strong mind. Stress raises cortisol and inflammation in the body. Studies show it is linked to preterm birth, low birth weight, gestational hypertension, and even long-term developmental issues in the child. Stress reduction helps even in complex cases. It improves uterine blood flow, supports better glucose control in gestational diabetes, lowers maternal stress hormones in twins or age over 30, and nurtures baby development.
That being said, Dr. Manisha, let's meet Shilpa Das. In her second trimester, she was overwhelmed, anxious, and barely sleeping. Her mind was consumed with uncertainties and unfounded fears. What if something goes wrong with the baby? What if I can't do this? This constant worry led to irritability and guilt. Her blood sugars fluctuated, not just from food, but driven by chronic emotional stress. Stress hormones interfered with insulin, and her reports showed up all these things very clearly. What Shilpa didn't need was not more advice. She needed guidance. Gently, we helped her take a pause, breathe, and understand. Through simple and consistent tools, guided breathwork, journaling, and weekly emotional check-ins, Shilpa began to feel a shift. She learned to anchor her mind, release her fear, and replace guilt with grace. Her sugar stabilized, her energy returned, and most importantly, her confidence bloomed. She carried her baby to full term. Today, the tiny baby girl is a radiant 2-year-old, joyful, alert, and incredibly smart. Shilpa often says, "The best thing I gave my daughter was a peaceful home." Her story reminds us peace isn't a luxury, it's a prenatal nutrient. Many women believe age defines success and feel helpless, assuming complications are inevitable. They give up on their health, believing their body won't support the baby. But age is just one piece of the puzzle. With the right support, mindset, and care, much is within their own control. And here is this secret: being 30 plus doesn't mean a complicated pregnancy. And here is what you need to know: you do not need extra hormones to fix yourself. You just need to work on your lifestyle to balance your own natural hormones. What matters far more is overall health, lifestyle, and a right mindset. Many women over 30, including thousands in our own community, they have had a safe, healthy pregnancies and babies, despite the belief that pregnancy is only for the young. Yet many women feel anxious the moment they cross that threshold. Dr. Manisha, can you please explain this with some medical evidence?
Yes, it is absolutely right. Age is just one factor, not the defining one. Being 30 plus does not mean a complicated pregnancy at all. Turning 30, 35, or 40 does not flip a switch that makes pregnancy risky. Yet, many women feel anxious the moment they cross that threshold. It isn't their bodies, but what they have been told. Google searches, distorted medical advice, and even gynecologists instill fear by saying, "Oh, you are high risk now, you will need extra scans, you might need a C-section, you will need more injections." A 2022 study in BMC Pregnancy and Childbirth found that women with healthy habits, regardless of age, had better outcomes than younger women with poor lifestyle choices. What really matters is lifestyle, healthy habits, balanced nutrition, movement, and stress management. These will always keep you and your baby healthy and safe. Let's not forget, in all ancient cultures, women had children in their 30s and 40s. They weren't shamed or labeled, it was normal. And those babies were healthy too. So, even if you are 30 plus, don't stress or agree to unnecessary tests or artificial hormones. We women are born with a perfect reproductive system. Complications arise not from age, but from modern unhealthy lifestyles. In pregnancy, what you eat, how you move, how you think, sleep, breathe, and respond to stress deeply impacts hormones like progesterone, estrogen, and human chorionic gonadotropin. Now, when these are balanced, your baby grows adequately. The good news is, by working on lifestyle, even if scans show less growth or less fluid, these issues don't persist through 9 months. They can be reversed naturally. Whatever your diagnosed problem, remember, it's not because of age. It's reversible and it is in your control. Hundreds of pregnant women were told they couldn't or put on medicines are now doing it naturally and celebrating their success. Oh, that's such a relief.
Now meet Jayanti Das, a 45-year-old maths professor. After 2 miscarriages, she conceived twins through IVF. She was taking 15 pills daily and weekly injections too. Doctors said her pregnancy wouldn't go beyond 7 months. She faced subchorionic hemorrhage, short cervix, low-lying placenta, and gestational diabetes. She joined us. We worked together. Slowly, her confidence returned. She began trusting her body and sleeping peacefully. Her diabetes reversed. No more pills, no more weekly scans, no more blood tests. She carried her twin pregnancy to 9 months and gave birth to healthy twin boys, Ram and Sham, each weighing over 2.5 kg. Neither of the babies needed an ICU. All 3 were discharged on the 3rd day of delivery. Today, Jayanti is a healthy and satisfied mom. Now comes secret number 4. normal delivery is possible for each one of you. Many women wonder, will I be able to do it? Is my body strong enough? What if something goes wrong? And so on and so forth. These doubts create fear and dependence. Whenever they think about childbirth, they only sink deeper in uncertainty. They are told normal delivery is too painful or unreachable, and many doctors suggest a C-section as a faster and safer alternative. But here is the truth. But here is what you need to know. Each one of you can deliver naturally, safely, and strongly. Despite rising C-section rates, many women, regardless of age, history, or medical conditions, including thousands in our community, still deliver naturally. Dr. Manisha, can you please explain this a bit?
Yes, it's true. Your body is designed to give birth. The wisdom lies in your DNA. I know you have fear about pain. Your friends and family have told you their painful and distorted stories. Misinformation does spread quickly, and society dramatizes pain. This leads to even more fear. With the right mindset and body strength, normal delivery is possible. Even if you are older or face challenges, you can still give birth naturally. Age doesn't decide your strength. Your pregnancy is unique. With the right support, you can do it. Sometimes a C-section is medically required, but it should not be the first choice. Globally, 1 in 5 births is now a C-section. And in private hospitals in India, it is more than 90% of all births. Hundreds of women in our community have delivered naturally. Even with diabetes, thyroid imbalances, or fibroids, many have had successful VBACs, that is vaginal birth after C-section.
Yes, Dr. Manisha, let's give an example to relate to this particular secret. Meet Gargi Fansalkar, a 33-year-old mom in San Jose, USA. She is an engineer and already had a 4-year-old son by C-section. Her hands were full and her life was busy, occupied. When she became pregnant again, she wished for a normal delivery. Living far from family in India, Gargi and her husband Amod felt lonely. They joined the program and MyWP gave them guidance, support, confidence, and connection. Slowly, things began to change. Her loneliness faded, her confidence grew, her sleep improved, and she even reversed her anemia naturally. She and Amod started bonding deeply with their baby in the womb. And then came the miracle. Despite her first C-section, Gargi gave birth naturally. Her journey is a beautiful example of belief, effort, and courage. Gargi and Amod remind us that with the right support, anything is possible. So now we have learnt the 4 secrets. Number 1, you do not have to be sedentary or on bed rest just because you are pregnant. Secret number 2, you do not have to be stressed in pregnancy. Secret number 3, being 30 plus doesn't mean complications. And the 4th one, normal delivery is possible for each one of you.
Now you have 2 options. Option 1, do it alone. It will be longer, slower, stressful, and risky without expert guidance. You may feel lonely experimenting all by yourself. But you have another option. Option 2, do it with our expert support using the proven 4-dimensional approach of My Wonderful Pregnancy. It's faster, it's efficient, evidence-based, scientific, and safe. It saves time. Remember, pregnancy is just 9 months and you will be never alone.
Here is our 4-dimensional integrated approach. Nourish, cleanse, strengthen and oxygenate, and de-stress and manifest. The so-called modern lifestyle creates many imbalances in both mother as well as the baby during pregnancy. The 4-dimensional approach of My Wonderful Pregnancy addresses all of these. It is all about our daily choices that matter. What you eat, how you cleanse, how you take care of your body, how strong are your muscles, bones, and the uterus, how you breathe, how you sleep, and how you nurture your mental well-being. All of these shape the quality of your and your baby's health. Let's have a look at the first dimension, nourish. In this dimension, you become your own dietitian. You do not need fancy food. You only need to know the what and the why of eating. That's where the Nourish plan helps you. We teach which foods are easy, safe, and nourishing. You will learn what helps your baby grow well and what to avoid. Together, you and your spouse start making conscious food choices for a healthy pregnancy. The second dimension, cleanse. You will learn two simple therapies, done at home, easy, safe, effective. They restore strength in your pregnant uterus. They ease acidity, bloating, constipation, digestion, headaches, and even bring a natural glow to your skin. The third dimension, strengthen and oxygenate. You have heard, and scientific medical research also supports that a gentle exercise and yoga are beneficial in pregnancy, but often feel scared to try. Sometimes family advises against it, and the doctors don't guide properly. So many women end up being inactive or just walking during pregnancy. Here, we teach exactly what your body needs. Safe prenatal exercises build strength, improve insulin sensitivity, and help maintain normal blood sugar. Ball exercises tone pelvic muscles, preparing you for a smoother delivery. Pranayama, breathing techniques, it brings oxygen to you and your baby. Meditation helps you calm down, being even more balanced. Together, all these things raise your chances of a normal delivery. Let's look at the fourth dimension, de-stress and manifest. Mental well-being is vital to create a healthy, smiling baby, happy baby. You'll learn journaling, visualization, all techniques to shape your dream pregnancy. I cannot stress how much important it is to de-stress. You will learn to release bottled up emotions, fears and doubts, and replacing them with peace, joy, and positivity. Remember, no medicine can do this. Sessions channel your energy and shift perception about pregnancy and childbirth. In this way, you and your spouse instill good samskaras in the baby while still being in the womb.
Join My Wonderful Pregnancy as soon as you confirm pregnancy with the first scan. Early, safe practices nurture your baby and help prevent common first trimester risks. After 10 weeks, you enter the batch. There are 13 weekend live sessions with me and Dr. Abhijit. Daily prenatal yoga until delivery, plus real-time support from your personal prenatal coach, your Wonder Guide. For the first 3 months, you connect with your Wonder Guide in live coaching calls. She answers questions, she guides step by step, and supports you throughout pregnancy. You and your spouse receive a complimentary consultation with me, including medical report review. If you miss a live session, recordings are available. This program is for both of you as a couple. Your husband plays an important role, joining weekend and personal coaching sessions. You will feel supported, never alone, as couples motivate each other. How will you know you are on track? In just a few weeks, you will notice changes in your symptoms and reports, showing that your baby is nourished and nurtured better.
We are confident and committed. However, what if you are unsure? Here is our offer. Try joining MyWP with full payment. And in case you do not like it, you can choose to leave My Wonderful Pregnancy and we give you your entire money back without any questions asked. This program, this offer is not for every pregnant girl. This is only for pregnant women who wish for a safe childbirth, wants to impart good samskaras, desire a smart and intelligent baby, and want a holistic, natural approach with minimal medicines. This is only for pregnant women struggling silently, feeling unsupported or lonely, or battling thyroid or diabetes or miscarriages, having a history of IVF and IUI, and so on and so forth.
By now, if you feel a burning desire to transform your and your baby's health, book a free consultation call with our prenatal expert. She will discuss your challenges, goals, and guide you to the next best step. Looking forward to seeing you in My Wonderful Pregnancy. If this feels like what you need for a joyful, healthy 9 months and fewer complications, let's talk. Over the next 5 days, our prenatal expert is available to guide you. Thank you for your patient listening.